Hello, I'm Dr. David Reith, and I'm an ASPS member surgeon. I'm here with one of my nurses, Mandy, to talk to you about drains. If you're having breast reconstruction, you're going to have at least one drain. They're not the most fun things in the world, but knowing a little bit more about how they work and how to care for them is going to make your recovery easier. Now, the drain comes in three different parts. This part is actually underneath the skin, and so you won't ever see it. There's then a tube which connects that to the bulb. This bulb collects the fluid that comes out. The reason we put the drain in is that fluid, or sometimes small amounts of blood, may develop in the areas where you've had your surgery, and removing them is important to make the healing go smoothly. So there's several things you need to know about the drains. First is something called stripping the drains. I'm going to have Mandy hold this here right like it's going into the body. Sometimes this tube will get a little clogged up by a small amount of blood, some protein and fluid, or even a little bit of tissue. The way you get it unplugged is to squeeze the drain close to where it goes into the body and draw it away from it like this. It creates suction, and then you let go of this hand and it helps milk whatever is in the tube into the drain. That's known as stripping the drains. You're probably going to want to do it every time you empty the drains. It'll just make them much more easy to deal with. If for some reason the drain gets clogged, sometimes fluid will come out of the skin around the drain. It's messy, but it's not the end of the world because the drain is there to get rid of the fluid. The next thing we're going to show you is how to empty what comes out of the drain. And I'm going to turn this over to Mandy.
Okay, we have put some colored fluid just to kind of demonstrate exactly how to empty the bulb. When this is always working appropriately, it will always have a suction to it, okay, when it's inside the body. Basically what you're going to want to do is you release the top, okay, and I always give patients these little Dixie cups. It's got the measurements on there. Turn this upside down, empty the fluid, keep track of how much is coming out of the drain, and then you always want to compress and hold as you are closing that back up.
Another thing about the drains is figuring out how to secure them, because you're not always going to walk around holding them. And again, Mandy has some very helpful tips.
What I recommend is to use a safety pin, and you can kind of put the pin in this little plastic area here, and you can pin the drain onto the bra to kind of help hold that up. And then when showering, I usually recommend getting a shoestring and kind of looping around and making a little necklace, kind of tying it around your neck to kind of keep it elevated while showering.
We hope that this information will make your recovery easier. Just remember, the drains will not be in forever, but knowing how to manage them can make it a little easier for you. Should you ever have a question, though, never hesitate to call your surgeon. Their staff wants to hear from you and wants to help you with your recovery.